My name is Jennifer Norton. I am Director of Coordinated School Health with Johnson City Schools. So my primary responsibility is our COVID response plan with Johnson City Schools. We do work daily with the Northeast Regional Health Office. We have a group of individuals that are experts in public health, and we work daily with them. We have a whole team dedicated to our school system. So daily, as we discover new cases, as we have direct contacts, as we have new situations come up, we are on the phone with them each and every time discussing the appropriate protocol to follow. Who should we exclude? Who should we not? Infectious dates. We walk through the entire process of how we've done the tracing to really try to get guidance from our local experts. Right now with COVID-19, we have a return to school algorithm that's been provided by the Tennessee Department of Health for us. We have very specific symptoms and a very specific process that we follow. If your child should wake up with any high-risk symptoms, as indicated on our return to school algorithm, new onset cough, loss of taste or smell, fever of 100 or greater, or shortness of breath, we would ask that they stay home. Also, if they should wake up with any of our low-risk symptoms, again, we would ask that you contact our school for guidance. However, if they have one low-risk symptom, we ask they remain out of school for 24 hours pending improvement. Or 2 or greater low-risk symptoms, we also ask that they will remain out of school. In those cases, 1 high-risk symptom or 2 low-risk symptoms, we would either need a negative COVID test to return to school, or we would need an acceptable alternative diagnosis from their physician, or they also have the option to remain out of school for 10 days after the onset of their symptoms. We are notified of a positive case in multiple ways. Many times our parents contact us to let us know that their child has tested positive. Other times we're notified by the Tennessee Department of Health that a child has tested positive. Many of our parents have concern of why did it take so long before I was notified that my child was in contact with this person. We have many different processes, and a lot of times it just comes down to how long it took for the test results to come back, or when that person chose to have that person tested. So if a child came to school Monday and Tuesday and they felt great, but on Wednesday they woke up with a little congestion and runny nose, they would have been kept out but not necessarily had to be tested. Then on Thursday, if that symptoms progressed and say they developed a sore throat, we now have 2 low-risk symptoms, and we've asked that parent to receive a negative COVID test before coming back. They may not test until Friday, meaning we may not have results till Monday or Tuesday. So we're almost a week later. However, we still have to go back to onset of symptoms to determine the date of exposure for that student. So many times it may be a week out, because that's just the process and how long it took before we were notified. And we also, from onset of symptoms, we go back 48 hours prior to that to determine the infectious period of that student. So if your student is identified as a direct contact, you will get a call from our school, most likely your child's school. They'll give you the date of exposure. They'll also discuss with you when your child can return to school. During that time, we ask you to go ahead and contact your school to find out about work and how to complete work while you're off campus. So we have to respect privacy for our students and our faculty. So many times when we're calling parents, it's not that we're trying to hide information or not be transparent, but we have to respect the privacy of that person that's tested positive. So many times we're not able to give a lot of information. The ways that we identify your student as a direct contact will be through our tracing process. We initially will start out by talking to the positive case. Who is positive? We look at their schedule. We look at their day-to-day activities. We really talk to them about who they were in contact with throughout their day. Do they ride a bus? Are they on a club? Or are they part of a sports activity? What classes do they have? We talk to them. Were you within 6 feet of anybody for 15 minutes or greater? Did you have direct physical contact with anybody? Did you high five? Did you hug? Did you share a drink or share utensils? After that, we'll usually pull seating charts and we go into the classroom and we measure our students within 6 feet of one another in a classroom setting, in a lunchroom, in a related arts. and that also your student can be identified as a direct contact through that way. So we first talk to the case, they provide us names, and then we also will go back and do contact tracing with the seating charts. Students are quarantined two different ways. One way, we are notified by the Tennessee Department of Health that they have been identified as a direct contact due to an outside exposure. So we receive information and they are asked to be excluded from school until their release date has been determined by our health department. The second way is if a student is identified within our school system. We've had a positive case of COVID-19, either faculty or student, and that student has been identified as a direct contact through our tracing process. So sometimes your student could be quarantined and sometimes your student could be excluded. The difference is your day-to-day activities throughout our community. So if your child has been identified as a direct contact, they've had direct exposure to somebody positive for COVID-19, meaning they potentially could become infectious. In certain cases where we've closed a school, those students aren't necessarily in quarantine. However, right now they're just excluded from school, meaning they can continue with their day-to-day activities with no restrictions. So there's two different ways your student could be sent home. One, they could present to our nursing clinic if they have one high-risk symptom and or two or greater low-risk symptoms. They will be asked to go home. We will ask again for the negative COVID test results before returning, or an acceptable alternative medical diagnosis, or again, you have the option to keep them out for 10 days. If you choose to have your student tested, we do ask that you provide that negative test result before returning to school. So please contact our clinic nurse to let her know that you've received that and have that with your student day of return, or they will not be admitted back into the classroom. Another way your student could be sent home, again, if they're identified as a direct contact to a positive case.